often do not look at health as a top priority until it forces us to pay attention. Nigeria is one of those countries with, unfortunately, one of the poorest health outcomes. But health is never a driver, or health is never prioritized when we go to the ballot box or when we go to vote, because we do not hold our government accountable. So health only becomes an obsession when there's a crisis staring in front of us. Now, we often say that health begins in communities. It sounds pretty obvious that health should begin in communities, right? Simple idea that health should absolutely begin in communities. But the reality we know is it doesn't. Health often begins in the neatly developed reports, in the well-crafted PowerPoint presentations, in the 4x4 matrices, in the frameworks. And these are often far removed from the very communities that are impacted and influenced by health. And that was why the organization I founded years ago was started. How do we bridge the gap between ordinary Nigerians and those health policies? Because everybody, each day, is focused on living out their normal reality and facing all the different challenges. Health is never really a top priority until it becomes a crisis. So when we say health begins communities, we know it rarely starts there. And I'll give you two examples. 2014, across 4 West African countries, there was an Ebola outbreak. The response was decided in the outbreak response frameworks, in the organizations, in the global community. But the response was very slow in understanding the very communities that were most impacted. So while many people, many families had to bury their loved ones, decision makers were still learning on the job how to respond to the Ebola outbreak. Yes, it didn't start in Nigeria. It started in Guinea, and it affected countries like Sierra Leone and Liberia before it reached our shores. But it wasn't until people in the communities were put at the center of the response. And it's that space, that gap, that circle between the communities and the policymakers was a space I knew that we do not want to exist in. So when the response now faced was in the communities, and people were able to share their experience and the trust that had not been built because the communities were not prioritized at the beginning, that is when change happened. And the outbreak in the other West African countries was under control. In Nigeria, as you all know in this room, we were spared from having such a devastating outbreak because of the life of one woman, Stella Dadevo. May her soul rest in peace. The second example, when I say that health only becomes an obsession when it now becomes a crisis, is the COVID-19 outbreak. 2020 was a time when every single person in this room was suddenly faced front and center by the fact that when we say health is wealth, and until we have health, we do not have anything, we all learned very quickly what that meant. How were people responding? Suddenly, everybody became a scientist, everybody became a doctor, but then the response to the outbreak did not start in the communities. It started in the main cities. It started in the airports. That was where things were prioritized, because the policy documents and guidelines had not thought about the people in the communities. So when the outbreak dissipated and we all went back to our normal lives, people in the communities, people in all our rural communities went back to living their daily lives and solving their daily challenges. And that's why I say that the space between policy and communities is a wide gap. So I'll give you another example. In about 2018, me and my team were part of a UNICEF project in 2 northern states in Nigeria. Our main single goal, the single intervention we went there for, those 2 northern states, was to ensure that the families, that women, that girls in those communities whose children were suffering from severe malnutrition were able to get access to the high-protein therapeutic foods that would enable their children to recover. We call these RETF, ready-to-use therapeutic foods. And basically, all it really is a small sachet with a very rich peanut paste that the children are given when they come to these stabilization centers. And so the girls and the women came with their children to receive these therapeutic foods. That was the single mission we went there for. But when we sat down with the young girls and we listened to them, and we listened to their stories, we realized, and you realize, that we are coming to solve one problem. But they are faced with a multitude of other issues and other challenges that they were having to contend with. Those included lack of economic opportunity. Many of the girls had left school very early. So that economic independence, they did not have it. Many of them did not have agency over their lives. They did not have access to normal contraceptives. They were not able to control or make any decision about the number of children they had. So whilst we came with one single intervention, it was very humbling and a learning experience for us, because health does not exist in a vacuum, and neither do communities. Communities do not live in narrow categories. People's lives do not live in narrow categories. There are a multitude of circles around them, and therefore, neither should the interventions that address those challenges. Another example, understanding what people truly need. Recently, in the last 6 months, we started what we call a polio demand generation campaign, again, in 2 states in northern Nigeria, with one single mission, again. Make sure that parents bring their children out to receive the polio vaccine. Sounds simple enough, but why was this so urgent? Many of you will know that in 2020, while polio virus was eradicated in Nigeria, we were the last African country to eradicate wild polio virus. There are only 2 countries in the world that still have wild polio virus, Pakistan and Afghanistan. So there was much jubilation and celebration in 2020 when that happened, understandably so. But since then, we know that many children miss out on vital, life-saving vaccines up to today, despite them being available. So we go to the communities, we're asking parents, bring your children out so that they can receive these life-saving vaccines. We explain all the reasons, it's for their health, but the question people ask, what else are you bringing for us? Because it's only when we bring vaccines, when we bring therapeutic foods, that they see us in the communities. What else are you bringing for us? because their lived realities are multiple. Health is not in a vacuum, because health is just one of the circles within the many interconnected circles in people's daily lives. So we started a community engagement strategy, Community Health Watch Project. And what we did is we trained young people in the communities to start writing their stories, documenting. So through the Community Health Watch reporters, they were able to document the stories, produce very simple videos. And we also held town hall meetings where people came together with the decision makers, local government chairmen, and sat together and actually spoke and shared their perspectives and shared their voice. And through this, we saw the difference it made. When a woman is having to go to a health facility and she's taking her child there for immunization, and there isn't even somewhere for her to sit comfortably, or a mother goes to a primary healthcare facility about to give birth, and she has to carry her own water in order to give birth. I'm sure many of you would think that is outrageous, but that was their experience, and they did not have a platform or a way to share it. So we created a platform that meant that that gap was being bridged, and their voices were being heard. And in addition to training the community reporters, they also used the local radio stations to also share, because we know in many places radio is one of the most powerful mediums. So another way we wanted to raise the voices of communities and share what was happening was a campaign that's now being run on social media, Know Your PHC. The reality is many of us do not even know where our local clinic or primary healthcare facility is. And why is this important? Because no doubt that many of you in this room, when you're ill, your first port of call is to go to a hospital. However, we know that for any health system to function and for any illness to be addressed, the basic level of care that should address those basic issues is a clinic, a primary healthcare facility. If a mother has a child with diarrhea or malaria, she shouldn't have to go to a hospital. In every community, there should be a clinic or a primary healthcare facility. But we realize that you cannot hold the government accountable to provide primary healthcare to the quality everybody deserves until you shine a spotlight on the gaps and the challenges. Because in many communities, that is their only source of access to healthcare. People in rural communities have to travel very far and wide to get to a hospital. And do they even have the financial resources to do that? But if their local primary healthcare facility worked, it would make things a lot easier. Because when we look at our statistics, maternal health, infant survival, Nigeria, unfortunately, is a country where we have one of the highest rates of maternal deaths and children under 5. And many of those issues could be addressed if the primary healthcare facility worked. So what we're encouraging people with Know Your PHC is go and look for your local PHC. Use your phone. Document what you find when you go there. Is it working? If it's not working, what are the challenges people are encountering? Who are the people who work in those primary healthcare facilities, those clinics? Because often we find that even with limited resources, where those primary healthcare facilities exist, you have healthcare workers who are working against the odds to save the lives of mothers, to support children, to ensure that mothers, when they come for antenatal, that they're there. But yet, it is one of the weakest levels of healthcare in Nigeria. And if we fixed that, there are many health issues that could be addressed. We have to start looking at health from where people live, wherever they live. We need to start from there. We need to listen, and we need to connect. And we need to do it with humility. Because when you understand the circles that shape people's lives, we're able to address the many challenges they have. Because if we can close the circle between systems and people and communities, we realize that people's lives are multidimensional, and coming to them with one solution and one intervention will not address all the problems they face. Because we can see and we know that people do not live and exist within narrow categories. And therefore, neither should the solutions that address those challenges be limited by the narrow categories and interventions that we use to address the problems they face every day. Thank you very much.